thorax. And thorax is one area where a lot of people get confused. So I will try to explain it to you, because what happens is that we are unable to identify that at what level the section has been taken. I told you the major landmark in the brain was ventricle. The major landmark in the chest is trachea. So now the point to be noted is, what you have to do with the trachea is you have to learn to draw it imaginary in the body. So you know that the trachea is starting at the C6, and then it is going, and at the level of T4, T5, it is dividing at the level of carina into the right and left mainstem bronchus. Do you agree with me on this? I think all of you will agree with me on this if I'm going to say this. Yes, there are some confusion whether it is dividing at T4, T5 or T5, T6. So I'm not going into that controversy, but you know that in the upper part of the thorax, it is dividing into the right and left mainstem bronchus. Now, trachea is an air-filled structure. It's an air-filled structure, and the point to be noted is, if I take a cross section at the level of trachea, can I say I will see a black tube like this? Whereas if I take a cross section after the carina, then I am gonna see two tubes like this, because these are the bronchi. And later on, obviously, I'll get the heart. Now, if I further draw the cross sections here, I will say that another important structure that is coming over here is the aorta. Ascending aorta is coming from the left ventricle. It is going up, it is making arch and then coming back like this. Do you agree with me? Now the point is how to identify that at what level the section has been taken. If it's a cross section of the thorax, I want you to focus on whether you are seeing trachea or whether you are seeing trachea, carina or heart. Whether you are seeing trachea, carina or heart. If you are seeing trachea, please understand, you are above T4. If you are seeing carina, you are at the level of aortic arch or heart to heart. Yes. So please see to this. This is the single most important help that will help you in identifying the cross section in the thorax. So if you see this cross section, I don't want you to focus on this. I want you to only focus on this. Only focus on this. I hope all of you will agree with me if I say that this black color structure that you could see over here, this, okay, let me just remove it. This structure that you could see over here is trachea. Now the point to be noted, please see to it, if it is trachea, that means you are above the aortic arch. And if you are above the aortic arch, what you are actually seeing are the three cross-sectional vessels. Let me draw it with the red color. Three cross-sectional vessels. So that means 1, 2 and 3. These are the branches of the arch of aorta. These are the branches of the arch of aorta. From right to left, these are brachiocephalic trunk, left common carotid and left subclavian artery. Brachiocephalic trunk, left common carotid and left subclavian artery, and the fourth vessel that you could see is basically the right brachiocephalic vein. Which will join with the left brachiocephalic vein and finally will form the SVC. Okay. Now this small air containing structure that you could see onto the left is esophagus. Obviously, this is right lung and this structure is left lung. Right lung and left lung. Okay. So the whole idea is that do not jump. First orient yourself with the radiological image, and then I am telling you it will be very, very easy for you to pick the diagnosis.